Well, let's pursue that. The Health Secretary says every adult in the UK will be vaccinated by autumn too. So is that the new timescale for the COVID crisis? Joining us now is Dr Bharat Pankania, Senior Clinical Lecturer at the University of Exeter. Thanks for coming on to the programme today. So these timescales, is it worth putting in motion some optimism, perhaps, that we can look forward to the beginning of the end?
Oh, we've always got to be optimist, but we've also got to be truthful and honest with our people. Otherwise, we lose them. Therefore, the narrative I'm hearing is that the vaccines are a magic silver bullet. It's not true, because even though we are immunizing at pace, until we've immunized a substantial number of people across the country, we cannot say now we start to drop our guard. So it's very important. People like myself have advised and advocated that perhaps we should run the operation on a 24/7 basis, only because I want as many people as quickly as possible to be immunized.
Is that practical to do something like that?
Well, the United Kingdom, indeed. So I thought about it long and hard before saying it. So the United Kingdom is an affluent country, and instead of having wasted a lot of money on centralized contact tracing, we can divert that money, have the resources, have the manpower, and streamline it so that at least the people who can attend in the deadly hours of the night can also do so, and we cover more people. The bottleneck, unfortunately, why the 24/7 operation may not work is not the manpower, but the shortage of vaccines.
And how worrying is that? How many more vaccines do we need?
So, the narrative is very confusing. So on the one hand, we are told we've ordered 100 million doses, but that doesn't translate to I have 100 million bottles ready to put into people's arms. So that's the issue. So we need a large flow of vaccines in bottles in the hands of vaccinators to be giving it. At the moment, we do have a flow, but it's not as big as it could be, and therefore we haven't scaled up as much as we possibly can.
So do you think these are highly ambitious targets and that the government has announced, certainly what Matt Hancock was saying today?
They are ambitious, but we've got to do everything we can to fulfill the targets. And, I'm concerned that if we don't have a large throughput of vaccines in bottles to put into people's arms, we may not meet those targets. But at the same time, we mustn't change the narrative as you've been vaccinated, therefore all is well. That's not true. You've been vaccinated, continue with all infection control measures until virus activity in the nation drops down.
I want to return to your idea there of potentially 24-hour vaccination programmes. Are you suggesting then the test and trace programme should come to an end?
Well, if we were absolutely truthful with case numbers of 1,000 per 100,000, under those circumstances, the centralised contact tracing cannot work. That is as is. It was always known it cannot work. And therefore, in the middle of a widespread loss of control, what do? Well, you've got to continue with contact tracing as well as you can, but you won't succeed. So invest in a rapid immunization program as well.
I suppose with 1.5 million or so people already vaccinated, certainly having had their first dose, that has taken some pressure to an extent off the NHS and has helped at what is a current crisis time.
Yes, it's only about 1.9% of the population. So it will have of course, it will have an individual benefit to the people who've been immunized. But on an NHS countrywide level, we are far away from it. Until we start immunizing to the level like what Israel has achieved, 20% of the population, then we will start to see the positive effects of fewer severe illnesses in the vulnerable groups, fewer admissions, and so on.
And I suppose the number of people being vaccinated, the fact that this will go up, will start to alleviate pressure on the NHS, which is really buckling, isn't it, now? And the worst is yet to come.
Unfortunately so. So again, my advice would be, whilst the vaccines are being rolled out, we've got no choice but literally to stay at home and don't interact with anyone. In fact, to be honest with you, Nick, as early as March 2020, I said we should perform as if everyone, every place is infected and infectious. If we had followed that line of everyone, every place, all the time is infected and infectious, we would have kept our case numbers down. We need to adopt that line urgently.
Just very, very quickly, medical experts, aren't they, calling for even further measures beyond the lockdowns we're currently seeing? I mean, what can happen now?
Well, unfortunately, they are right, because the case numbers are just rocketing up. And also we've got what we would call a more infectious strain. So although it's not more disease causing, it will generate more cases. And as it generates more cases, there will be more hospital admissions and so on. So we've got no choice but to say, batten down the hatches, stay at home. We need to get control of this.
All right, Dr. Pankania, as ever, thank you for your thoughts today.
Thank you.